Good evening. My name is Dr. Krishan Puri. Uh, my topic is public health aspects of refugee health, a review of the evidence on health status for refugee globally. Summary. Public health aspects of refugee health, a review of the evidence on health status of refugee globally. What is migration? Migration is a critical public
Krishna,
health, political and social challenge. Yes, sir. Hello?
you can use up and down arrows for next and previous pages. Kindly use of
Okay.
it.
Okay, thanks. So 1 in 7 people on the planet is a migrants, 1 billion in total, and billions more are impacted by
Yes, you
migration.
can proceed. Louder, please.
Okay, okay. And in Europe also is the leading continent in receiving international migrants, and approximately 500,000 people who sought asylum in Europe in 2013. According to recent reports, high number of human trafficking from Asia, Arabic countries, and North Africa to Europe. So, asylum seekers and refugees, those who did not make voluntary choice to leave their origin country and cannot return home safely. Migrant is a person who moves from one place to another in order to find work or better living conditions. And IDPs, internally displaced persons and refugees, are extremely vulnerable to human rights abuses, especially the absence and denial of mental and physical health care. Government must ensure that migrants' rights are truly protected once and for all. The UN General Assembly, in its historic 17th year presence, was leader with the opportunity to acknowledge that migration is inevitable, necessary, and desirable. This is a picture of these asylum seekers and refugees who are crossing the borders. Uh, and this is also the refugee camp in where refugees are taking shelters. And one of the uh, uh, proverb is that falling is not the issue. The issue is how soon one takes to return to equilibrium. Does if all goes well, this is what it will be happen if in a camp. So most of the migrants anticipate good life and well-paying jobs in the countries of resettlement, good schools and education for their children, health and peace. If coming from war-torn countries, this might not be obviously the case, thus culminating in variable levels of expectations and anxiety if not checked, and this would be systematically trickle down to stress, depression, and ultimately to post-traumatic stress disorder. So problem is these undocumented migrants are people within a country without the necessary documents and permits, considered at high risk for health problems because of their irregular status and the consequences of economic and social marginalization. And there are other problems which are neglect of refugees' rights to a chance of survival, and there is also a threat, public health threat or danger to community extremely vulnerable to human rights abuses, and there is also prejudice to access health care. So these refugees or migrants, they anticipate good life and well-paying jobs in the countries of resettlement, good schools and education for their children, and also these levels of expectation, anxieties, they always trickle down to stress, depression, ultimately leads to post-traumatic stress disorder. And we have I have done like a systematic literature review of article dated between 2001 and 2015 on embassy seeking for Medline, Cochrane, control trials, and WHO databases. Review of documents that suggest policies and interventions to improve healthcare access and delivery for undocumented migrants. So our results and discussion were refugees mostly have only access to emergency care across Europe, and even in the countries where they are fully entitled to healthcare, formal and informal barriers hinder their access. Also, refugees are extremely vulnerable to human rights abuses, and primary need for advanced communications with refugees and coordination of activities between agencies, either public or private, within the and beyond the healthcare structures. The study seeks to unveil the channels that create the neglect of refugees' right to chance of survival. So, from this research, it is clear that across the globe, access to the primary health care amongst the refugees is overwhelmingly shaped by the regulations of the migration process and legal framework of individual states and nations. The systematic literature review seeks to detail the problems that come up in the absence of full implementations, as well as serve a refugee need in their interim. Survey on the causes of increased refugee immigration. Organizations with the mandate to provide and maintain a sanitized environment failed to do the same due to a constant budgetary strain by the radical growth in population of both the local citizen and refugee in the camps. So these are my references. I took most of the references from International Migration Report 2013 and 61st World Health Assembly, Health of Migrants, Geneva World Health Organizations, and other literatures. So conclusion is that from this research, it is clear that across the global, access of primary health care amongst the refugees is overwhelmingly shaped by the regulations of the migration process and legal frameworks of individual states and nations. This raises concerns for both public health and migrant care. On the basis of findings, policy options are suggested regarding data collection research, entitlement to healthcare, information and communication, training and intersectoral approaches. There is a need, a clear picture of the needs and health status of undocumented migrants, how this impacts on the health of the whole population, and where changes could improve the health situation. The study recommends that improved data are imperative towards supporting intersectoral work in addressing healthcare needs of refugees. Future strategies in reducing inequality in healthcare access by undocumented migrants need to use correct and transparent information and effective communication strategies both about the right to health for the migrant and also to support healthcare providers in their roles.